Questions?
Governor, there's been some talk about changing up sort of vaccine distribution to get more shots in the arm, more first shots in the arms of people, rather than going with this 2 doses. I just wonder what your take is on that, and whether or not you think that could help vaccinate a larger swath of people at an earlier amount of time.
Yeah, so with respect to the current conversation the feds are having about dosing and vaccinations, there's a call tomorrow with the feds to talk about this stuff. All I've seen at this point is the news reports, and honestly I hesitate to comment on those until we actually hear firsthand what people are discussing. I will say this, at the end of the day, the goal here needs to be to ensure that people get, in my view, adequate dosing for the vaccine to be effective for the anticipated period of time. Now, if there is something associated with what everybody learned from the many clinical trials that were done on the Moderna vaccine or the Pfizer vaccine that would justify changing some of the guidance and some of the rollout as it's currently been discussed, or there's something associated with the AstraZeneca vaccine which has been approved in the UK, or if ultimately there is something about the J&J vaccine which was considered to be a 1-dose vaccine, which as I understand it is still in clinical trial, then I think that's perfectly appropriate to engage as part of the conversation. But the thing everybody needs to remember here, and I would include, the federal folks who are making some of these decisions when I say this, there has been from the beginning a nervousness among a lot of people about the integrity of the process associated with the development of these vaccines. And we, based on the conversations we've had with our own healthcare professionals and researchers here in Massachusetts, as well as the conversations we've had with professional folks at the federal level, believe that the current protocol and the current policy, based on the current knowledge and information that's available, delivers on the goals and objectives that were originally put forth here, which was 2 doses, one of which was 21 days apart, one of which was 28 days apart, would produce a roughly 94 to 95% effectiveness with respect to the Pfizer and Moderna vaccines. So from my point of view, I want to hear from the feds at a very deep level of detail about what it is they are discussing and how they would choose to go about changing what they originally told us was the most appropriate way to roll this out, and was in fact the way that was vetted by the people on our medical advisory board and others.
Governor, can you tell us which places are being considered for mass vaccination sites? We've heard Fenway Park and Gillette thrown around.
Do you want to speak to that, or you want to wait a day or two? Okay, yeah, give us a day or two to nail that down.
And are these sites that will then also be used for the general public? Is that the mentality the state has going into this?
I think that's likely, yeah, that this idea would be that these sites would become, the mass vaccination sites would become sites that would be used originally as part of the first responder piece, and then become more readily available, more generally available as different groups and populations roll through the rollout, yeah.
Governor, are there any specific...
shed some light on the expiration of the doses. I guess Leahy Hospital told us on Friday that they had gotten some last-minute doses. They were able to vaccinate some employees, but do we have potential for vaccine doses going to waste if they get out of this freezer system and now the clock's ticking?
I mean, do you want to speak to that? I mean, my view on that one is part of the reason why the early stage of this, especially with respect to the Pfizer vaccine, which as we all know requires very cold and very significant temperature to maintain its effectiveness. Part of the reason for why the original rollout there was designed to only go to particular healthcare providers or pharmacy organizations that had the ability to actually do the deep freeze and to keep that stuff effective and properly stored for. I think the at this point in time, there's enough demand for dosing at the provider level that I don't think we're going to run into situations where people aren't able to find places and spaces to distribute the vaccine. I do know that in a couple of community health centers, which we're working with Moderna, is that right? Did distribute some to some of their local first responders rather than keeping them in storage. And on the margin, you know, I think our point of view is it's important to use it.
Have we lost any yet? Any doses, actual doses?
Not that's been reported to us. We have not lost any. Yeah.
Governor, on that point, we've seen some restaurants coming forward saying, look, we've got freezers, we've got a lot of refrigeration space, unfortunately we're not using them, we don't have customers. Are you looking for help from local businesses to refrigerate vaccine?
So one of the things in the guidance is you can't mix the vaccines with other, like food storage. But we are actually, we've not yet, but we're starting to plan to reach out to large employers, both in terms of employers' ability to vaccinate their staff, of course, as well as what kinds of storage opportunities they have. And to just, to the question, the other question is, you know, it's very important that we want the vaccines utilized. And in these early days, providers are estimating what they believe the use is going to be. And so if they have slightly overestimated by, you know, like they assume 60% of the individuals would be vaccinated. And so if it's 55% and you have some left over, we obviously don't want the vaccines wasted. And so they, healthcare and others have been collaborating with one another to ensure that the utilization of the vaccines within the time period so that they're not wasted.
So there is a system way here told us that they basically got it from another provider.
Yeah, so it is informal. I think as some of the healthcare providers have realized that they're not going to be able to use in that time, within the time period, they have reached out to others to make the vaccines available. I would say there's good communications going back and forth because we all understand how important these vaccines are and nobody wants to waste. But obviously people are estimating what they believe that vaccine program will be for the day. And instead of, you know, obviously reaching out to others to ensure that we can maximize use of the vaccines.
Secretary, on the topic of field hospitals, I'd just like to follow up. You
Sure.
mentioned a couple of weeks ago you coming close to something in southeastern Massachusetts. Has that come to fruition? I'm hearing from Brockton Hospital that they're gridlocked right now.
So we have stood up 2 field hospitals. So the DCU in Worcester, which has a physical capacity of probably up to about 150, 200, and is now currently staffed for 75, and had 59 patients over the course of the weekend. And Lowell has just opened, which has the physical capacity of 75 and has opened with sort of, I refer to as a pod of 14, and will be 28 by the end of this week. So we are not planning on a 3rd field hospital at this time. We are planning on opening a long-term care facility. It's called Buttonwood, down in the southeast for discharge-ready, COVID-positive nursing home residents as a way to create space for people who are discharge-ready. And there is every day there are phone calls with all the hospitals in their regions to figure out patient load, transfers of patients, and the like.
Secretary, when you spoke with public safety officials last week, did
Yep.
any of them express concerns or skepticism regarding the vaccine? Some have told us that they don't feel comfortable taking it, and I don't know if there's any first responder specific awareness campaign or any efforts to respond to those who don't want to.
So there were 2 questions that came up during the hour meeting, and they were very specific to someone. Someone had a very specific medical condition and wanted to know if they should take the vaccine. And in those sort of very specific, you know, an individual's medical concern, we actually say the best thing for you to do is to go back to your healthcare provider and ask them. I mean, asking someone who is receiving treatment for cancer as to whether they should receive a vaccine, you know, that is such a specific medical situation that really that's not a frequently asked question kind of response. That is something that we have said to people, you really need to go back to your healthcare practitioner.
you know, we were building out public awareness per se, but no, it didn't come up. It was really more the mechanics of how will the vaccine program work out. We showed a draft map of the locations in Massachusetts showing that we have, you know, pretty good coverage. And it was those kinds of questions, like would it be drive-in versus appointments? And we talked about appointments make it sort of more convenient for first responders. And then did remind people that if you see like these 60 sites on the map, it doesn't mean like for the second shot you go to some other place. You need to, it's a reminder that wherever you have your first dose, you need to go back for your second dose. So it was a very matter of fact, very positive. We took some questions in. We're gonna post the responses to all the questions that we you know, responded to verbally as well as at the end. There's always somebody who at the very end, as you're saying goodbye, sort of says, well, I have 3 more questions. So we asked them to submit them, and we're going to post it up as an FAQ.
And I'm sorry, how many of those dots on the map, whether they were the existing 60
No,
sites?
so, I'm sorry.
I was just going to say, how many plans are there for sites in Western Massachusetts among those 4 counties?
I just can't recall how many dots at this moment, but there were 60, I believe it was 62, when we did this last week, there were 62 sites identified, and there are more coming online, and when it goes live, we can all see what exists.
Secretary, I wondered if we could.
Hello, Bruce.
Said there were 287,000 doses, I think,
Received.
116,000 distributed to providers.
Administered.
So there's a huge lag. You said there made it sound like it was just a lag period. That's a huge amount, isn't it?
Some of the 287 we didn't get until right before.
For the weekend, right. And there's, you know,
They roll in. It's not like we got
Right.
287 from the first 65,000
Right.
doses, so it showed up on December 23rd.
Do you wanna-
We got 287 over the course
Over
of the
since the
last
beginning.
week or 10 days of December. So some of the doses we didn't actually receive until I think the 29th.
Yep,
of December.
30, the morning of the 30th, right. So, and there's up to a 4-day lag in the reporting back into MIIS. So that is why the weekly dashboard will give you a very good sense of what's been shipped, distributed, administered, reported. I mean, those are really the 4 things to look for. And the numbers the governor gave also includes second doses now that are coming in that need to be then distributed in the next 14 days. So this is a rolling vaccination program, Bruce, is the way to think about this.
But you're not troubled by that lag of 100 and some thousand.
What I would like is, as everyone, is the minute something is administered, that's reported in the MIIS. That's just not, you know, feasible. So I have been informed that I should become comfortable with a several-day lag in reporting. So I'm standing here saying I have become comfortable with a several-day lag in the official reporting into the MIIS system, which is the system of truth. And I think the Thursday dashboard, well, I know everybody would like the data every day, the Thursday dashboard is a source of truth for us at this point.
Can I say one other thing to follow up on the previous question that about sort of encouraging people to take it? I mean, literally based on all of the conversations that I've been on and the Lieutenant Governor's been on with folks in the healthcare community about people's willingness to take this, I have come to the conclusion that the over-the-top big message from unknown parties of almost any kind, maybe with the exception of Dr. Fauci, are nowhere near as effective as peer-to-peer conversations. It's really clear to me at this point that the people who haven't chosen to quote-unquote go first in their particular group, if their group has had access to the vaccine, are people who are primarily interested in talking to their teammate, their colleague, their, you know, fellow practitioner about their experience with the vaccine and then making their decision based on that. So we'll do a lot of things to publicly promote why it's important for people to take the vaccine. But in the end, I really do think the most important conversations are going to be the ones that take place between peers and between clinicians and their patients. That's going to drive the decision-making around how people choose to participate in this.
Governor, your current restrictions are in place. The president has several senators and also up to 100 Republican members in the House that are joining him and wanting to challenge the election. They're saying they'll do that. Do you think Republicans should continue to challenge the election right now? And do you agree that a commission should be launched to audit?
I can't remember who said this over the weekend, but someone said President-elect Joe Biden won the election fair and square. He did. There have been numerous trips to the courts since Election Day, at the state level and at the federal level, and they've been in front of appointed Republican judges, appointed Democrat judges, elected Republican judges, and elected Democrat judges. And the electors that were chosen across the country were chosen by Republicans and chosen by Democrats, and were Democrats and Republicans. I remember standing in front of this group and talking about the election of 1860 and how worried people were about whether or not the electors would do the right thing. And they did. And that's exactly what is happening now. And I think the noise and the accusations and the commentary about challenging this or that is an affront to democracy and to the voice of the people who turned out in record numbers in this election to support a whole bunch of candidates up and down the ticket. And for the life of me, I can't figure out how people in my party can say all the other elections in which their folks barely won were fine, and the only one that they seem to have any concerns about is the one at the top of the ticket. And it is my hope that these initiatives fail and the electors do the right thing, and the transition, the orderly transition that we desperately need as a nation. We just finished 20 minutes of Q&A with you all about the largest and most significant and potentially life-saving vaccine rollout in U.S. history that I think everybody at this point in time would say can't happen fast enough. And I think everybody would also agree that there have been bumps associated with the rollout, which we all expected and anticipated, with the notion that eventually the wheel would start to spin and things would work the way they should. That, in my view, is where our colleagues at the federal level should be focusing their time and their attention, is doing everything they all together possibly can to make sure that every vulnerable American, every healthcare worker, every long-term care resident, every long-term care staff member, and everybody else gets access to those 2 doses as soon as is practically possible. That should be the focus right now of what our colleagues in Washington are up to, in my view.
Governor, your current restrictions are in place until at least January.
Say again?
Your current restrictions on businesses are in place until at least January 10th. I know that's still a week away. I'm just wondering what kind of heads up are you going to give people on whether or not you will extend that, given the post-Christmas surge we could see?
Yeah, we'll probably be back sometime toward the end of the week based on the data to make a decision about whether or not to extend that beyond, to extend the current regulations that are in place, orders that are in place beyond January 10th. Yeah.
Governor, with the question you answered of mine, I understand sometimes the challenges can come from the certain people, speaking out in the public, and there's a question about whether certain campaigns work, but is there any concern that sometimes the conversations first responders or others might be having with their colleagues or their own police chiefs or fire chiefs might be that of skepticism? I mean, is there any concern that all of this might be affecting the long-term rollout plan, that there's, so many people in various industries who are still skeptical of the vaccine?
I don't think anybody expected at the beginning of this process that there wouldn't be people who would think about this as a wait and see. And that's not unusual. I will say this, generally speaking, the first responder community has been justifiably concerned about their health and the health of their family members ever since this pandemic began. And many of them have advocated to the committee that the Secretary set up that they should be early in the process, given the role they play, what they do, and how they are affected by their time at work with regard to their exposure to COVID. And we agree with that. And I believe the vast majority of them and I'll tell you the other reason why I believe the vast majority of them will accept the vaccine, because they, like many of the folks in the healthcare community, in the long-term care community, say the same thing when they talk to the Lieutenant Governor and me about this, which is, I'm out there all the time. I worry about the places and spaces I'm in. I'm afraid that if I get it, I might give it to my family members. I mean, they are exactly the kind of folks who talk a lot about protecting their family. And that's why I do believe in the end the vast majority of them will step up and get it.
How quickly do you expect, I know Secretary Sudders said it didn't look like you could make an appointment just yet if you're a first responder, but how quickly do you expect that process to happen? Within a couple of weeks, days, months?
The actual process of delivering the shot starts on Monday.
Oh, no, excuse me, okay.
Governor, you just signed a major healthcare bill. Can you just speak to the importance of telehealth right now?
Yeah. So we were just talking about this upstairs. Since we issued our executive order around telehealth, which was back in April, I think, was it March? There have been more than 1 million telehealth visits in Massachusetts, and patients and practitioners have adopted this enthusiastically as a way to do a number of things. One, it certainly limits infection, right, which is a good thing in the world we live in at the moment. The second is it doesn't require a patient who may or may not be able to figure out how to get to where they need to go by the time they need to get there to go to an office. I mean, you can do it from your home, you can do it from your desk, you can do it from wherever you might be when that appointment gets scheduled. And as a result, you talk to almost anybody in the healthcare world and they'll tell you that dropped appointments, the percentage of appointments that get dropped has dropped dramatically in the areas where telehealth has been most significantly adopted, and especially with respect to addiction and mental health services and behavioral health services. It's been a giant door opener for practitioners and for patients. Same goes, by the way, for the scope of practice changes, which we also issued as an executive order to make it possible for nurse practitioners and other care deliverers to actually practice up to the top of their license. That's a huge win for patients and for the practitioner community in terms of people's ability to access care at the appropriate moment as we come out of this, now that that's baked into law. The feds took care of surprise billing, which was something that was in our bill to begin with. which was also terrific. And the legislature in the budget made several changes to enhance the relationship between behavioral health, which in many ways has been treated as a stepchild by the healthcare world and by the rest of the community, took a couple of real barriers to access for people's ability to access behavioral health services, or for even a behavioral health practitioner to get paid or credentialed, which were also elements that were in our original bill, and put them in the FY21 budget we signed. So I think all of these things are really positive developments under very difficult circumstances that will be permanent pieces of our healthcare world going forward, and I think we'll all be better off because of it.
Governor, your reaction to Jim Lyons being reelected to your party chair?
Well, first of all, obviously, congratulations to Jim. The Lieutenant Governor and I have been spending most of our time working on COVID and a whole variety of end-of-the-session issues, and aren't really thinking very much about election issues at this point in time. There'll be plenty of time, hopefully, to talk about that when the world's a little more normal.
Before you go, can I ask you real quick about the surge? We're 10 days after Christmas now. Is it worse than 10 days after Thanksgiving, or how would you compare looking at the data? Is the Christmas surge bad?
They're different. I mean, I should probably let the Secretary speak to this. I think the Thanksgiving thing was worse than this. But this isn't over yet because we're just a little bit past New Year's. But the thing that troubles us all the most is, since Thanksgiving, the average age of the people who are being hospitalized has increased dramatically, and that has real consequences with respect to life and death. If you go back to kind of the beginning to middle of November, I think the average age of the folks in the hospitals was about 60 or 61. I think now it's around 73. That, I think, is by far, and you talk to any of the folks in the healthcare world, they'll tell you that that's the thing that's most distressing to them as well.
Governor, with a day and a half left in the session, how nervous are you that a couple of big bills are not going to make it?
So we were talking about this over the weekend. There are several really important pieces of legislation that are still in conference. The climate bill is coming out, I guess, today, and we'll get a look at that. But obviously the transportation bond bill, which has really big consequences for the Commonwealth for a couple reasons. Number one, we literally are almost out of transportation bond authority, and we need that bill for the spring construction and summer construction season, and we also need it to sign multi-year agreements that involve federal reimbursement, because you actually have to demonstrate to the feds that you have the authorization to pay for a federally supported project, which many cases take a couple of years to actually access, have the feds sign off and say, yes, you can spend the money. There are also a bunch of other pieces to that bill that are particularly important to the public transportation system as well, and we certainly hope the legislature will find a way to get that one over the goal line. And then the other really big one that is in conference, and I know people have been working on it, is the economic development bill, which includes more money for small businesses, has the housing exclusionary zoning limitations removed. It's been incredibly important to us, and we've been working on for several years, which will make it possible for us to do a lot more housing development, senior housing, affordable housing, workforce housing, transit-oriented housing. I mean, there's a lot of really important housing elements that are tied up in that. And then our more traditional economic development programs are also in that bill. And I think we're really hoping that despite some of the differences that are between the House and Senate on both of those, that they'll find a way to get it over the goal line before tomorrow night. The legislature's been telling, the legislature's been telling us that they're working these hard and that they know that these are really important that they're hard to get over the goal line anyway, because they're usually big and complicated, and they know that they need to get them done now, because if they don't, they got to start all over again. And in some cases, especially around the housing piece, which we've been working on for several years, and a lot of local communities have been literally desperate in their support for those reforms so that they can do some work around creating a more affordable housing infrastructure here in Massachusetts. And on the transportation stuff, I mean, if we can't get some of that stuff enacted, it's going to make it hard for us to support a spring and summer and beyond construction season, especially on projects that involve federal reimbursement. So they're really big deals, and people are telling us that they know they're big deals and they're going to get them done.
Does that apply to sports betting as well, as far as you can tell?
I know that's one of the issues that's part of the back and forth. We filed a sports betting bill, I think, in the spring of 19. And most of the rest of New England is there, and we think it's, you know, at this point it probably just makes sense for us to be part of that world, since pretty much everybody else on the East Coast is. But I certainly know that's part of the debate and the discussion between the House and the Senate.
Thank you.
Thanks, folks.